Welcome back, Super GPs. This lesson is dedicated to teaching you how to provide bulletproof anesthesia on the most difficult to numb area of the mouth, the lower posterior region. I have found that the traditional method of performing an inferior alveolar nerve block is inconsistent in providing a level of anesthesia necessary for invasive dental procedures, including endodontic treatment, especially on a hot tooth. So I recommend utilizing a technique that's more similar to a Gao-Gates technique. I know it sounds complicated, but the difference mostly has to do with the location of the needle placement, and once you see it and do it a few times, you'll learn to love it because it's more consistent and gives you a more reliable level of anesthesia. You're going to want to use a 27 gauge long needle for this technique. I know some say that the patient can't perceive the difference between a 27 and a 25 gauge needle, but man, that 25 gauge needle looks like a spear to me, so I stick to a 27 gauge. All right, so let's get into the operatory and on to getting our patient now. Here we go, friends. Let's administer bulletproof anesthesia on our patient's lower posterior tooth, in this case, in preparation for treatment on tooth number 19. Before we give our topical anesthetic, let's go over the recommended needle placement. Traditional placement of the needle for an inferior alveolar nerve block is at an imaginary bisecting line splitting the thumbnail in the pterygomandibular depression just alongside the pterygomandibular raphe. But a Gao-Gates injection is given at a higher level, just below the distal lingual cusp on the upper second molar. This is going to anesthetize the mandibular nerve further upstream and give you more consistent results for invasive dental procedures like endodontic treatment. So let's get into it by first giving your 2-minute application of topical anesthetic. Confirm no epinephrine contraindications, then grab your loaded syringe of Septicaine. Have your patient open as wide as possible. Inject just below the area of the distal lingual cusp of the upper second molar and at a depth of about 2/3 the needle. It's super important to confirm proper needle placement with a negative aspiration. If you're running into bone, I would recommend withdrawing the needle slightly and changing your entry angle to slightly more mesial. That should allow you to penetrate to a proper depth. Inject a full cartridge of Septicaine slowly and withdraw your needle. Reload your syringe with a second cartridge of Septicaine and give a buccal infiltration with an entire second cartridge. If we were attempting to anesthetize one of the premolars rather than the first molar, the same mandibular block would have been performed. The only difference is that the buccal infiltration would be at that site where we're working on. Wait your 5 minutes, a real 5 minutes, and confirm profound anesthesia with your cold test, assuming you're dealing with a vital tooth. As you can imagine, this would be the most common location to need supplemental anesthesia in the form of an intraligamentary or PDL injection, but approximately 75% of the time, it's all you need. All right, Power Up Endo Nation, I hope you picked up some value bombs in this lesson and are ready to make modifications to how you administer bulletproof anesthesia for lower posterior teeth. Remember, these are universal skills that you can use for crown preparations, oral surgery, or endodontic procedures. Thanks for watching.